Niacin is increasingly recognized not just as a vitamin, but as a nutrient with pharmacological precision, a compound capable of targeting specific intracellular signaling pathways with the kind of selectivity more often associated with engineered drugs than dietary components. While historically used for its broad lipid-lowering capabilities, niacin is now understood to exert highly coordinated actions through well-defined molecular pathways, particularly CD38 and liver X receptor alpha, LXRa. This dual targeting mechanism enables niacin to modulate cholesterol metabolism, inflammation, and cellular resilience with remarkable specificity, positioning it as a prototype for micronutrients that act with precision rather than blunt systemic force. At the cellular level, niacin's most striking effect begins with its activation of CD38, a multifunctional enzyme that catalyzes the production of nicotinic acid adenine dinucleotide phosphate, NAP. NAP is not just a metabolic byproduct, it is a potent second messenger that mobilizes calcium from lysosomes through TRPML1 channels. This calcium flux is essential for maintaining organelle function and initiating transcriptional programs that restore cellular homeostasis under stress. One such program is the upregulation of LXRa, a nuclear receptor that controls genes responsible for cholesterol efflux, including Niemann-Pick C1, NPC1, ABCA1, and ABCG1. By selectively activating LXRa in macrophages, niacin promotes the export of cholesterol from lysosomes and cells, directly combating foam cell formation and lipid-induced inflammation. Importantly, this activation does not spill over into the liver to drive fat synthesis, a problem that has plagued synthetic LXR agonists, demonstrating niacin's context-dependent specificity. This selectivity is not incidental, it is structurally and biochemically orchestrated. Unlike other NAD precursors or broad-spectrum antioxidants, niacin relies on tissue-specific expression of CD38 and the presence of lipid stress, e.g., oxidized LDL in macrophages, to initiate its signaling cascade. This requirement for localized enzyme activity and stress-responsive pathways makes niacin's action conditional and targeted, a form of metabolic precision that avoids the off-target effects seen with less discriminating compounds. Niacin also influences inflammation with a high degree of control. It reduces IL-1 secretion not by suppressing cytokines wholesale, but by targeting the upstream events that provoke inflammasome activation, namely cholesterol accumulation, lysosomal damage, and calcium imbalance. This upstream intervention spares normal immune function while resolving chronic, sterile inflammation in the arterial wall. In this way, niacin acts less like an immunosuppressant and more like a cellular detoxifier, restoring function to stressed immune cells. What makes niacin especially noteworthy is that its pharmacological actions arise from a molecule that is both endogenous and essential. Unlike synthetic agents that introduce foreign chemistry into the body, niacin builds on and enhances intrinsic pathways. It represents a model for how micronutrients, when provided in pharmacologically informed doses, can engage with cellular machinery in ways that are both natural and highly effective. In sum, niacin is a rare example of a nutrient that exhibits drug-like precision in its action, selectively activating CD38 and LXRa, modulating calcium signaling, improving cholesterol efflux, and resolving inflammation in a cell and context-specific manner. Rather than acting indiscriminately across tissues, niacin tailors its response to the metabolic needs and stress signals of a cell, setting a new standard for how we understand the therapeutic potential of micronutrients. This reframing invites a broader reconsideration of how nutrition intersects with molecular medicine and highlights niacin as a foundational tool in targeted metabolic and inflammatory regulation.